Hi, I am Dr. Anupama Sudheer, working as a dermatologist in Ottapalam, Palakkad. In this video, let me talk about the common fungal infections and their treatment. Fungal infections are nowadays very common and it includes ringworm, athlete's foot and yeast infection. Athlete foot is also called tinea pedis. It is a fungal infection of the foot. Usually the patient presents with peeling, redness, itching and burning. Sometimes there will be blisters and sores. It is very common infection and it is usually seen in patients who wear ill-fitting shoes and who use common pools and bathrooms. It is caused by a microscopic fungi that resides on the dead tissues of the toenails, skin and hair. And the very mild tinea pedis is treated with topical antifungals, and in severe case we use oral antifungals, and the patient have to make sure that the feet must be kept clean and dry as the fungus thrives in the moist environment. Jock itch, it is also called as tinea cruris. It usually affects the genitals, inner thighs and buttocks, and it is most frequently seen in summer, warm and wet climate, and patient usually present with red itchy rash that is often ring shaped. It is contagious and it can be spread from person to person through direct contact or indirectly from objects carrying the fungus. And in most cases, treatment include keeping the affected area dry and clean along with applying antifungal ointments. In severe cases, we go for oral antifungals. It is contagious and it can be spread from person to person through direct contact or indirectly from objects carrying the fungus. In most cases, treatment include keeping the area dry and clean along with applying antifungal ointments. In severe cases, we go for oral drugs. Tinea corporis or ringworm, it is a fungal infection of the skin. It can appear anywhere on the body and it looks like a circular red flat sore. The outer area is raised and the inner area appears normal. It can be spread by direct contact with infected people or animals. Heat and humidity may help to spread the infections, and diagnosis is made by the appearance of the rash and the symptoms the patients describe. And the treatment gives when the patient having very mild disease, we go for topical antifungals. In case of severe disease, we go for oral antifungals. Next is the yeast infection. Yeast infections are the cutaneous candidiasis and are caused by yeast-like fungi called candida. It usually occurs in warm, moist, creased areas in the body like the armpits and the groin. And it is very common in people who are obese and diabetic, and people taking antibiotics are also at risk. Candida can cause diaper rash in infants, and it can also cause nail infections, and it can cause vaginal candidiasis in females, and oral thrush, which is a form of candidiasis, affects the mouth. Patient with skin candidiasis present with burning, itching and there will be rash and oozing. In case of nail candidiasis, there will be pain, swelling, pus discharge will be there with yellowish or white discoloration of nails. In vaginal candidiasis, patient will complain of whitish or yellowish discharge with itching and redness. And the treatment of vaginal candidiasis, we give vaginal suppositories, and the skin yeast infection are treated with antifungal creams. There are certain things that you have to keep in mind when having a fungal infection. Wear loose cotton dry clothes, take bath twice a day, always use fresh dry clothes to wipe off water from the body. Use antifungal dusting powder and wash your towels, clothes and bedspread in hot water and dry out in the sun. If you are a diabetic, check your blood sugar levels regularly and make them sure that it is in a normal level. because increased blood sugar level is a risk factor for fungal infection. If any of your family member is having a similar infection, encourage them to take treatment. And if you have any pet having rash in their body, show them to a veterinary doctor. Check your pet animals for rashes. If there is any, consult them to a veterinary doctor. Always complete the full medication that your dermatologist is prescribed. Incomplete treatment will result into the recurrence of the fungal infection. Do not scratch. Scratching makes the rash worse. Do not wear synthetic clothes, ill-fitting jeans which do not allow air to flow through them. Do not use over-counter medications because these over-counter medications contain steroid. This steroid gives faster relief from itching and burning sensation that makes the ringworm worse, which leads to spread this infection to a very large surface area. There are certain things that should be taken care of when having a fungal infection. Avoid steroid containing creams that will actually worsen the infection, and complete the treatment given by the dermatologist. Stopping the treatment prematurely will lead to the recurrence of infection. And apply the cream 2 to 3 cm of normal skin in addition to the rash. Avoid wearing tight clothes, jeans and shoes, and keep your nails short and avoid same nail clipper for the affected and unaffected nails. Keep yourself dry and clean as a fungal infection occurs in the damp areas. Correct diagnosis and adequate treatment is necessary for curing a fungal infection. So, if in any doubt, consult a dermatologist and take treatment without any delay. Thank you.